Hello, evening everybody. I'm Eloise. I'm a UK pharmacist of over 20 years and I'm passionate about explaining medicines and supplements in an easy to understand way and debunking medical misinformation. Welcome to everybody that's on here this Sunday evening, and welcome to all those around the world, if it's maybe the morning or the evening, wherever you are in the world. I'm just, while I'm waiting for people to come on, I'm just going to run through my disclaimers. So, just to let you know that anything that's on this live stream is for information and educational purposes only. It's not for individual medical advice. So, please make sure that you do talk about anything that you hear on here with your own healthcare professional before you make any decisions and changes. And I'll just run through the banner. If you could like the stream, that really does help the YouTube algorithm, share my videos to more people. And if you do like my content, please make sure you subscribe so that YouTube shows you more of my videos. Welcome to Tanya. Welcome to Amanda. Great to see you all. Oh, from Texas. I'm assuming, is it quite warm in Texas today? It's been nice and sunny and warm here in the UK. Welcome, Nelkita. Yeah, great to have the usual crew here. If anybody is on here lurking, that's fine as well. You're more than welcome to comment and ask questions, but if you want to just lurk, that's fine. Oh, kitty food run. I had to do a kitty food run this afternoon. So the kittens are eating plenty. So yeah, had to go get some more kitten dry food and kitten wet food. Does seem that one of the kittens is always using the dry food and one of the kittens is always using the wet food. Trying to give them a mixture, but you know what cats are like, they will be awkward. And then the big two cats keep going through and pinching the kitten food because obviously it tastes more nutritious. So I just have to keep an eye on that and make sure that they don't start putting on any weight. Yeah, great to see everybody chatting in the chat. So I thought I would cover hormones, which is, yes, quite a clickbait title because hormones are always on Instagram and TikTok reels. People are always shilling different supplements to balance your hormones and cure your hormones. And unfortunately, hormones are not that simple. There is no simple supplement that can balance your hormones. In fact, hormone is just the word for a chemical that has an effect on different parts of your body. It's like a signal molecule that one part of your body will release to tell other parts of your body what to do. And there is actually over 50 different hormones in your body, although most people will just talk about the sort of top 2 or 3. Usually thyroxine, the main one, because obviously hypothyroidism and hyperthyroidism cause many different issues. And then obviously the main one is people go on about the sex hormones, the estrogen and progesterone in women and the testosterone in men. Although there is a slight crossover and there is a slight bit of both in the opposite sex, which a lot of people don't realise. And then there's things like cortisol, which is your adrenaline, which sort of your stress hormone. People keep talking about having an overload of cortisol, and unfortunately, that isn't a real thing that needs treating with supplements. If somebody really does have a problem with high levels of corticosteroids in their body and such like, that would be something like adrenal crisis, which actually is a medical emergency and not something that gets treated with supplements. So Nell Keita says, Percy has learned what time breakfast is, and I have all 3 demanding wet food each morning now. Yes. Unfortunately, my cats keep trying to demand food earlier and earlier. So I have got Nobby currently likes to wake me up at 5 o'clock in the morning. And I'm trying my best to get him out of that, and I'm trying my best to ignore him. So I'm getting to the point where I am actually just picking him up and putting him out the door and going, no. But yes, I do think that cats train us, we don't train cats. Um, So I've just put this diagram up here to try and sort of explain how much there is different hormones in the body. Obviously, there is a lot that's getting mentioned about the hormones, ghrelin, with the GLP-1 inhibitors that were used for diabetes, the hunger signal, which is the one that's used for on these weight loss medication. Oh, so yeah, so Tanya says, I've learned more about the lazy pancreas in the last 4 years. Yes. So the pancreas is extremely important. It says here it releases insulin, glucagon, and somatropin. So there is the different types of diabetes. Now, so type 1 diabetes is what is an autoimmune condition where your own body's immune system has basically killed off your pancreas, producing no insulin, none at all. There is also other issues that go with that, but the main one is no insulin at all. And insulin is very important every time you have sugar, because the sugar goes into the bloodstream, and yes, you need sugar in the bloodstream to all your cells in your body to work, but you need it to be at a constant level. So what your body does is move some of that sugar um, through the different processes in glucogenesis. Some get stored into your muscles as the glucagon, and some get stored as fat. But your body has this whole system to try and make sure that your body's sugar levels in the blood stay between 4 and 7, and then it stores it elsewhere until it's needed, and then it fetches it out at moments of stress. Cortisol is part of that system as well. So type 1 diabetes, insulin is needed. Otherwise, high levels of sugar are just going to continue to build up. Hi, Cal. Great to have you on here again. I'm not really going to talk too much about diabetes, because I have already done diabetes special, and I can always do another diabetes special as well. But there is great new advances for type 1. There has been released to say that the new hybrid loop for type 1 diabetes, so that's where you have the sensor on the arm, you have an insulin pump on your side, and the two talk to each other in a closed hybrid loop system, so that it sees what your sugar levels are doing. It alters the amount of insulin that's being slowly pushed into your body. You might occasionally need to give it a quick top up if you decide that you are eating a large meal. But the advances in that is great, and there is the new NICE guidelines have come out to say that over the next 5 years, they actually want to offer the hybrid loop system to all type 1 diabetics. All newly diagnosed children are being offered it over the next few years, but they are going to be doing it. I think, yeah, as Tanya said, the Dexcom and the Omnipod 5. So yeah, so that is hopefully going to be rolled out for the majority of people with type 1 diabetes. Not everybody gets on with a hybrid loop. You are also dependent on the technology. Some people don't like being dependent on the technology. Some people's bodies just don't like to follow the correct pattern and have their own uniqueness. Maybe if they've got other comorbidities going on as well. But it is the hope that more and more people can be having this hybrid loop system, which is basically just like a mechanical pancreas as such. And yeah, so Tanya says, yeah, diabetic ketoacidosis. Yes. So if your sugar levels get too high, and your body can go into ketoacidosis, and that's just because your body will then start producing ketones, which are acidic. It makes um, your body go acidic. So when you see all these people saying the supplements that can either alkalize or alkalize your body, they really can't. There is no such thing as a supplement that can alkalize your body. Your body keeps your self in homeostasis around sort of a neutral pH all the time. Something has to be seriously wrong for your body to go acidic. And if you do go acidic, it is a medical emergency that needs treating medically. There is no sort of amount of alkaline water or just drinking bicarbonate soda to put it right. Yeah, so Tanya says, Sean has the Dexcom G7, but it doesn't talk to the Omnipod 5 yet. They're just rolling out the pods that talk to the G6 and the G7. Yes, I'm not exactly sure which ones are for which. For most of these, we just leave it for the diabetic specialist nurses to put it all together, and then they get put on. But yeah, the technology is getting better. But yes, there always has to be a backup of fingerprint testing just in case, to just double check, because although they can be fairly accurate, the sensors, they can sometimes be 15 minutes, 30 minutes delayed. So if somebody has just eaten a big meal, which is very high content of quick releasing sugars, it will be delayed. Also, if somebody does extreme amount of physical activity, that can suddenly drop the levels very quickly and very low, which therefore also needs to be checked. Tanya says, no, there's no such thing. And I tell people off all the time. It's the one thing, if you like the taste of alkaline water, that's one thing, but it's quite literally doesn't happen the way people think it does. Exactly. And we eat foods of all different pHs. So you can have things, that contain acetic acid, citric acid, like your very acidic fruits. You can eat them. They're not going to alter your actual bloodstream. Most of the time when you eat things, your stomach's a pH of 1 with hydrochloric acid in there, because that's what it uses to start breaking down sort of your meats and your proteins and all your different foods. And then you can have other things like the vegetables and such like that can be quite alkaline. Also things like milk, dairy, other things, they can be quite alkaline. None of them are really going to alter your body and your body's actual pH, because your body does that itself. It moves the pH by breathing out. So when you breathe out carbon dioxide, that lowers, you're blowing off carbon dioxide, that lowers your pH. So your body can regulate it like that, and with what you excrete through your kidneys as well. So your body's got this whole mechanism of keeping everything in state. And also the calcium and the different electrolytes in your blood system keep it buffered. It's like a buffer solution. Don't know whether you all remember in chemistry, you used to be able to have buffering solutions of certain amount of salts that it didn't matter how much sort of, you'd have to put either a lot of acid or a lot of alkaline in it, but the buffering solution would keep it at that pH. And that's basically what your blood does by making sure all your levels of the electrolytes are correct. And when it comes to that, you've got all these different hormones here that do help with your different things. So you've got your thyroid, but next to your thyroid, you have your parathyroid, and that actually releases things like calcitonin and your parathyroid hormone, and that regulates your calcium levels, which in your blood, which then also regulates the calcium levels in your bones. You've got things like the antidiuretic hormone and such like from the pituitary gland that alters how much your kidney excretes different salts and retains different salts. So it is extremely complicated like that. was I going to say? So the same with pancreas type 1, it's totally being killed off and shut off, and there's no insulin. When it comes to type 2 diabetes, there's the two ends of that. There's the side where the pancreas is getting tired and worn out and isn't producing as much insulin. And then there's the other side where your body has become resistant to the insulin that is being produced by your pancreas. And that quite often is due to fat content of your body. So people that are overweight and obese, there's so much more of the body that's the insulin's going to have to try and act on. So you've got insulin resistant. Your body is resistant to the insulin. It takes a lot more insulin to affect it. So your pancreas is continually trying to pump out more insulin to deal with the size of your body, and it can't. And feedback loop, sugars high. Yes, I did touch on this diabetes 1.5 in my last diabetes live stream. Now, I did research it. I did know about it for that live stream. I can't remember it off the top of my head to talk about it. But yes, there is this one where it starts off because it's in an older person, and it may take a few weeks for it to start. So the GP or whoever's coming across the person's sugar levels being high and the HbA1c high, they think it is type 2. But actually, within a few weeks, their pancreas is totally not working, and they are fully dependent on insulin, and so they are more like type 1. And I think you have to check some other hormones and check some other systems as well. I think you need to check whether you've got certain antibodies, and then you get this the diagnosis of this alternative diabetes. I have actually, so I heard about it because people mentioned it to me on my live stream, and I did some research in it, and I actually come across, as I would say, a patient in the wild with it when I was doing it, because we've been doing some sort of things where we look at patients on the type 1 register and on the type 2 register and checking they're on the right one, and we came across one, and then they were type 2. They were diagnosed as type 2, but now they definitely has type 1. So we couldn't take out the old read code because we need the new read code, and they did definitely have both, and they had the crossovers of type 1.5. So yeah, things aren't always easily put into just one or the other category. People can be complicated. People can have multiple comorbidities at the same time. One of the other things that comes across is people can have diabetes during pregnancy, so gestational diabetes, which due to the extra load of the baby, the extra sort of weight of the baby, and the extra blood flow that's required, and the extra stress that's required on the body, it can then cause diabetes. That often needs treating with insulin, because insulin is the only definite safe thing during pregnancy. You don't want to be treating with anything else that might cross the placenta and for the baby. And that often resolves, but somebody who has had gestational diabetes is then at a higher risk of having type 2 diabetes later on in life. And so they should always therefore be called for regular reviews of their HbA1c going forward. Yeah. So, hiya, Christina. Welcome to the live stream. Tanya says there's the celeb recently diagnosed with the ladder type 1.5. Okay, I might see if I can find them and follow that. I am always interested to find out, because it's good. I like it if there's celebrities out there, shows the diagnosis, shares their diagnosis, and provides good information out there. As long as it's sort of positive information and correct information, then it can be really good. Cal says, my boss is dealing with that right now. I'm assuming you're meaning diabetes of some sort. I have gone off on a few little tangents. Um, uh, he's now a Dexcom advertiser. Yes, so there's different types of the Dexcom. As you said there's earlier, there's the Dexcom 5 and 6, which are being used for the hybrid loop systems for people with type 1. Now, there's the Dexcom 1 Plus, well, the Dexcom 1 and the Dexcom 1 Plus, which are used for people with type 2 diabetes. So in the UK, we're just trying to upgrade everybody who have been on the Dexcom 1 for type 2 diabetes onto the Dexcom 1 Plus. Because the Dexcom 1, when it came on the market, needed a separate transmitter to the actual device. But the new one, the Dexcom 1 Plus, it's all in one. So it's only the one thing that needs replacing all the time, which is much easier. So we're just going through the process of making sure all the patients who are on the Dexcom 1 get upgraded to the Dexcom 1 Plus. We've got different thresholds over who should and shouldn't have the sensors. So we've recently done some work on people that were who have the blood glucose testing through the finger prick testing that weren't on meters that are sort of up to grade. We've called them in, and then some of those we have suggested that they might need to go onto continuous monitor. So we recommend the continuous monitor for those people that have got type 2 diabetes who are at risk of hypos because they've got insulin or they've got one of the medications that actually causes a hypo, such as the glycoside. And then they need to test to check that they're not having hypos. And then if they're needing to test more than sort of 5 or 6 times a day, actually benefit from having one of the sensors on the arm so that then they don't need to do all of those. So a lot of people with type 2 diabetes don't actually need to do much testing. They just need to be concentrating on their diet and taking the medication and having the HbA1c. Because for type 2 diabetes, the HbA1c is a much better marker because the blood glucose level, when you do a test, is just an instant result of a one time in space, whereas the HbA1c is actually an average of how much sugar's been in your system over a period of 3 months. So it counts the highs and the lows. So, okay, so Tanya says we don't have the 1 and the 1 Plus in the US. Okay, that's interesting. I do wonder about this sort of different ones. So in the UK, for people with type 2 diabetes, it's either the Libra 2 or the Dexcom 1 Plus that's used. I think there is another brand out there that is marginally cheaper, but it isn't used very often. Yeah, so you've said type 2s in the US usually end up on the Freestyle Libra. Yeah. So, hi, Coconut. Um, yeah. So the type 2. So obviously with the insulin, that's how it was always treated. Obviously now with the type 2 diabetes, we know it's a lot more complicated than just the insulin. And actually just replacing insulin in type 2 diabetes can actually make things worse because as you have your sugar level increases as you eat and you release the insulin then causes that sugar to get stored as fat, which then can gain weight. And having extra weight means that your body becomes more insulin resistant, which worsens the diabetes, and it can be a vicious cycle. So actually, for many people on type 2 diabetes, putting somebody on insulin is the last resort once you can't actually control it with anything else, and controlling it with other things that help modify either the pancreas working better or reducing the insulin resistance is much better. And that's why the GLP-1s have come. So all of these ones that affect the stomach here are what are being used. So we've got the gliptins. We've then also got the glitazones, which actually act on the kidneys and help kidneys process off extra sugar that shouldn't be there. So I'm just going to move on to a few other things. So I was going to sort of move on to the thyroid. So thyroid hormones. You've got your T3 and your T4 thyroid hormones that your thyroid produces most of the time, and it keeps your metabolism in check. So your thyroid is helping your body regulate how quickly it does things. So it switches things on so that you burn. I'm trying to think of the way of explaining it. So it switches. The more thyroxine you have, the higher your metabolism is. So the easier it is to do things, engage your body, to do activity. Whereas the less you've got, the more your body's sort of going into sort of the sleepy side. So quite. I'm just trying to think if I could find. I did find a good diagram that explained. Yeah, I don't know whether this is going to thing. So with hypothyroidism, you end up with a reduced heart rate, you struggle with fatigue, you struggle with cold, you can gain weight, you've got dry skin, memory problems, your stomach is slowed down, so you can have constipation. Um, it can also cause sort of depression because it's slowing down your brain. Your brain is sort of slowed down, and you can also get it. It also can affect your liver, and it can also raise your cholesterol levels, and also can lead to things like fatty liver. So that's with the hypothyroid. The hyperthyroid, where your thyroid's producing too much thyroxine, goes the opposite way. So your heart rate goes up, so you end up with heart palpitations. You can end up with tremors because your body's always on edge. Um, you can struggle to sleep. You can lose weight quickly because your body is your basal metabolic rate's up. You're always on the move. Your body's always working. You end up with diarrhea because your intestines are working too quickly. You've got an increased appetite, but you are losing weight because you're moving more. You're sweating. You're hot. You're anxious and you're nervous. So it's sort of the opposite, and the two opposites. Because if it's in balance, everything's in track, and the thyroid is actually affecting all of your different body's immune system. So your thyroid levels, if your thyroid level is too low or your thyroid level is too high, then in theory it should act on your pituitary gland, and your pituitary gland should see whether it's too high or too low. If it's too low, it would then produce thyroid stimulating hormone to then go back onto your thyroid to cause your thyroid to produce more. So it's actually a balance between your thyroid and your pituitary gland. And so whenever somebody has hypothyroid or hyperthyroidism, they should have a full thyroid panel, which does the T4, the T3, and the thyroid stimulating hormone that's produced from the pituitary gland, so that you can work out whether it's actually a problem with the thyroid or a problem with the pituitary gland, because they need treating differently. If it is just a problem with the thyroid gland being sluggish, then your thyroid stimulating hormone will be high and your thyroid levels will be low, and then you'll be supplemented with the levothyroxine. However, if your thyroid stimulating hormone is low and it's not actually stimulating your thyroid, then there may not actually be a problem with your thyroid, and then that's when you would get sent to an endocrinologist to try and find out why your pituitary gland is not being stimulated and not producing the thyroid stimulating hormone. And then when it comes to having a high thyroid level, the hypothyroidism, there can be many causes of that on why your thyroid is overproducing. And obviously there's the things like the goiter, and this is where somebody may end up having to have a thyroidectomy where the thyroid is removed. I know of a couple of people who have had the full thyroid removed, and you end up with a scar along this crease here where they open it up and remove all of the thyroid. Very occasionally that can be thyroid cancer. And so sometimes following on from the thyroid, there can also be radioactive iodine and such like. So, and then once somebody's had their thyroid removed, they automatically then become hypothyroid and then have to be supplemented with thyroxine for the rest of their life, um, manually. But next to the thyroid is the parathyroid glands, which are actually on there as well, and they regulate calcium and your calcium levels in your body and your bones. So they're interlinked. There is many people that try and say that there are supplements out there to help with thyroid, and quite often these things that contain iodine. Now, it is actually very, very unlikely that somebody is actually iodine deficient in their diet. And actually, taking supplements with iodine can actually be more problematic, um, and not actually resolve any issues. If you do actually have a problem with the thyroid, needs to be seen by an endocrinologist. There's not really any supplements that can be done to help with the thyroid. Just trying to think, is there any particular hormones that people want me to go through? Got here and think you've got your hypothalamus and your pituitary glands and your pineal gland. They're all very close together, right in the center of your brain, and they basically monitor all of the different levels in your body and then try and restabilize them. Now, the pineal gland regulates between melatonin and serotonin and your circadian rhythm, and I have talked about that. So Tanya says the one that's always confused me was melatonin. So, yeah, so melatonin and serotonin are very similar. They're both made from the amino acid tryptophan. So it is important to have enough protein in your diet that's got tryptophan in it to help with production of serotonin and melatonin. Your pineal gland is right there in the base of your brain, and it is regulated by circadian rhythm and from light. And even people that are blind can still have the receptors in the back of their eyes for seeing a certain amount of light. And if they don't, then sometimes their circadian rhythm can be totally off the wall because they don't actually have that sort of light. And obviously, a lot of people nowadays are struggling with their sleep because we have so much natural artificial light and blue light from devices and such like that we use well past sunset, and then we're expected to get up early for doing our jobs and school and such like. And really, to help our natural melatonin levels, we really need to ensure that we've got good sleep hygiene. And it can be very difficult to move our circadian rhythm. Some people have their circadian rhythm likes to be at 25, 26 hours a day and continually sort of move. It's called delayed sleep syndrome. So if they're left to their own devices, they'll quite easily start going to bed after midnight and wanting to wake up at noon. That's very common for teenagers, and it can be very hard to get them back. In fact, sometimes the solution can be, instead of trying to push the sleep back, is to just do like you would with jet lag and just force yourself to stay awake and then sleep the following night early to sort of force yourself back if you've got delayed sleep. There's on Instagram, I follow the Sleep Doc. He's really good. He really explains sort of the sleep cycle and the melatonin, the serotonin, and the sunlight. And he has done a thing of how to help kids get back into a good sleep pattern before school, and how you might want to sort of fetch it back by 15 minutes a day for younger children. But for teenagers, you might want to throw them the opposite way and allow them to stay up later and later and later until they're back at the normal system. But yeah, so melatonin, most people have a surge of melatonin in the sort of middle of the evening. that makes you sleepy, makes you drowsy, and allows you to fall asleep. We all have that sort of drowsiness time, and that is actually the time that you should go to bed. Um, if you push past that and force yourself to stay awake, you will do that by your body actually releasing cortisol to keep yourself awake. Basically, giving yourself a caffeine boost internally with your cortisol to keep yourself awake. And that actually can then totally counteract melatonin and stop you going to sleep. And that can very happen with kids as well. Oh, I get you, Cal. I have a drowsy time at about 3 or 4 in the afternoon, which is normal as well. Um, right, let me just get back to my train of thought. Kat just says, I have found that melatonin does absolutely nothing for me. I've been sleep dysregulated my entire life. I remember staying up crying all night, several nights in a row, times before 6. I'm assuming you mean 6-year-old. Yeah, some people, their natural melatonin isn't there. A lot of people with neurodivergence don't seem to produce as much melatonin and also don't seem to respond to melatonin the same. And whether you have your own internal, so endogenous melatonin, or you take it externally, exogenous melatonin, it works in the same way. And if your body isn't responding to its normal melatonin itself, there is a good chance it might not actually recognize and work with external melatonin either. And just like if a child or as an adult, you override your internal melatonin by getting yourself hyped up, worked up, drinking caffeine, having bright lights, and you've sort of got rid of your internal melatonin and overridden them and kept yourself awake. That can also happen if you can take external melatonin. So having external melatonin in tablet form or gummy form doesn't work unless you have all the sleep hygiene together. Otherwise, you're just going to override it like you would your internal melatonin. So it's got to be alongside good sleep hygiene. So a nice, steady bedtime routine, to have had exercise earlier on in the day to actually have tired your body out, but then a nice relaxed time of a routine that your body knows this happens, this happens, this happens, sleep happens. So whether that's a bath and reading and then bed, trying to cut out all blue light for a couple of hours before going to sleep, making sure the room's dark and reducing that amount of actual sunlight as well, and calming down the systems. But unless all of that is done alongside actually adding in the external melatonin, it's still not going to work. Okay. Yeah. So Kat says, I think my issues are probably some kind of early presentation of the bipolar. My mother was saying it's never been okay. Unfortunately, as I said, with certain types of neurodivergence and with other types of mental illness, the pineal gland just doesn't produce the melatonin. It just doesn't have its own circadian rhythm. And sometimes, yeah, you because of that, also doesn't matter how much external melatonin is, and it is a fact of learning how to actually cope with the amount of sleep that your body has and when your body actually wants you to sleep. Cal says, I get sleepy from caffeine and hyper from sleep supplements. Yeah, AUDHD brains be weird, definitely. In fact, it is one of the things that people with ADHD, stimulants calm them down. So caffeine calms them down. And a lot of people with undiagnosed ADHD or ADHD where they've never been able to get a consultant have often always self-medicated with caffeine to calm themselves down. And the amount of people go, oh yes, well I'll have coffee before I go to bed to put me to sleep. And you're like, I wonder why. And yes, there is a very slight amount of people that can get hyper from sleep supplements. Now, that's usually more the antihistamine sleep supplements, the hydramine, can't pronounce that one, or the chlorpheniramine, the Piriton, and the Benadryl. There is a very small subset of people where those drowsy antihistamines actually cause hyperactivity, and quite often there is the crossover with people that are neurodivergent and ADHD. Um, so, yeah, so Tanya says literally Benadryl makes John go wild. Yeah, and it's very common. There is with ADHD, a very subset just get hyper on it. It seems to have opposite effect. And that's with all of these different hormones on the body. Just because they might have one effect on people, because everything is always a feedback loop, whereas it could have one effect in one set of people, it can actually have the opposite effect in other people, depending on where it hits in a feedback loop in a person's brain. And if your brain's wired differently, it'll act on feedback loop differently. So, unfortunately, melatonin isn't the answer for a lot of things. It is all about management, and it can be the fact that with people that have got bad sleeping habits, it's more about trying to get rid of the anxiety and the worry about the insomnia, getting rid of that and actually learning to accept that your sleep pattern is weird and how you can work around that. Obviously, with small children, it is very, very stressful for the parents, because the parents are trying to get the child to have a sleep pattern so that they can actually fit in with a day of school, and the parents can fit in with a day of work. But there needs to be a sort of acceptance of the fact that yes, you might not sleep when you're supposed to sleep, and that you might need to find other activities. Things like seems to be very common in the genetics of my family. We tend to like to want to have a nap in an afternoon, early evening, stay up over midnight, then go back to sleep and have another sleep. So a dual phase sleep pattern, which historically there used to be a lot of people used to genetically have a dual phase of sleep with 2 4-hour sleep, 3 to 4 hour sleeps in a day rather than one long 6 to 8 hours. Also, you've got people that are night owls and you've got people that are early birds, and that would make sense in the old sort of traditional sort of cavemen. You would have those that would stay late to guard the campsite, and you'd have those that get up early to then take over. So a bit like shift work, and obviously shift work. Then I'm going to say shift work is a totally other kettle of fish that totally messes up people's circadian rhythms. And there is actually good evidence to show that if you can keep a good circadian rhythm, it is better for your overall health. Those people, shift workers, because they're continually moving their circadian rhythm all over the place, increases up the amount of their cortisols, their stress hormones, and can actually lead to higher rates of diabetes, cardiovascular disease, and such like later in life. Okay, Kat says there was a lot of anxiety of the child of how inevitably I'd be awake alone in the darkness with noises for hours. The idea that I can get up and do something comforts me. Yeah, and that's the other thing. To be able to be relaxed and allow your body to be asleep, you have to have a good, safe attachment to the people around you, a good, safe environment, and having anxiety and cortisol levels up will not allow your body to sleep. So, yeah, I'm just going to go back because I'm pretty sure. Cal said, the amount of people I have seen that say they learned they had ADHD because people gave them Adderall as a party drug and everyone was tripping and they felt clarity. Yeah, and it is. So when people take things like the amphetamines as a party drug to get high, and actually you end up more chilled, then yeah, you can show that actually, yeah, your brain's wired the opposite way. I like to say it's just wired differently. Because there is some theories that actually maybe people with ADHD may have been the more creative people that actually allowed things to evolve for humans much better. I'm going to go back. Oh, I think somebody said, does spironolactone affect hormones? Yes. So spironolactone was originally produced as a potassium-sparing diuretic. So it is used for people who have got fluid retention and heart failure to take off excess fluid from their bodies and reduce the amount, so reduce blood pressure because you're reducing the amount of fluid and reducing the amount of fluid for somebody with heart failure. But they did find that with people that were taking spironolactone as a diuretic, it helped clear up certain types of acne. So they do actually use spironolactone for people with PCOS and acne of a hormonal nature. It seems to have some sort of anti-androgen effect. So androgen is more of the sort of the testosterone, estrogen type hormone. And when that is causing problems, so it's causing sort of acne, maybe hair growth on the chin in women, so symptoms that they get with PCOS, spironolactone does actually work as an anti-androgen and can actually help with hormonal acne and with PCOS symptoms. Yeah, so doesn't get very used very much on the NHS as an anti-androgen and as a treatment for acne. Occasionally, dermatologists will recommend it, but it is used very much privately by private dermatologists for the treatment of acne. So that's more where I've seen it. So I haven't really seen it used as much on the NHS for acne, but I have seen it for sort of privately for acne. I have also seen it used sort of with PCOS and such like. Okay, so yeah, so you're in Florida, so yeah, it's a different system, and what I don't understand quite which things are insurance pays for in the US. I'm assuming it's a similar sort of system to the NHS in the UK. There'll be the things that the insurance have as per the insurance guidelines, like we have as per the NICE guidance on the NHS, and then other things that you'd actually pay more privately and pay extra for. Okay, Tanya says, Sean's ADHD is severe, but the stimulants are causing his skin picking and mouth picking issues to increase. Now trying to find a balance. He's 11 and already on an SSRI. Yeah, so that's it. So although the stimulants may solve some of his ADHD issues, they may sort of, heighten other issues. SSRIs are used in children for anxiety. It's usually fluoxetine can be used, I think, from the age licensed from the age of 6. A few more are licensed once they get to 12. A lot of medications. So the two usual thresholds are 6 and 12 for most medications. A lot of medications get the license in for children between 6 and 12. And then usually once somebody reaches 12, they're usually classed as having an adult functioning liver and kidneys for the metabolism of drugs, and are usually getting towards the weight of an adult and the way that they tolerate most drugs. So for majority of drugs, as soon as you reach 12, suddenly most of the adult drugs are suddenly then available to use, and they've actually done the testing in children over 12. There's only certain drugs that get tested and licensed between 6 and 12, and then very few drugs sort of between 12 and 6, and even less below the age of 2. So usually for most drugs, it's either, 2, 6, 12 are the usual thresholds. And yeah, it depends on what's being tested. Oh, Amanda says that my insurance pays for it. That's great. Yeah, Tony says it depends on your insurance if they'll pay for certain meds. There's no real rhyme or reason behind it. I have to say it does sound like that because you've got so many different insurance companies and what they'll pay for and how much they'll subsidise different medications. In the UK, it is a bit more streamlined. Obviously, we have differences between England, Wales, and Scotland. There's some slight variation, but most things have been approved by NICE guidance. We have what we call our clinical knowledge summaries that show the most usual regime. For the majority of things, most people don't actually have to pay for any medication. If they do have to pay a prescription charge, it is a prescription charge, and that is exactly the same no matter what the medication is. I think it's about £9.50, I think, at the moment per drug. But as soon as you're on more than 2 medications a month, then you just pay for a prepayment certificate that is about £100 for the whole year that you can pay by direct debit, and that covers any of your medications. So really, in the UK, nobody should be that much out of pocket. I hear so many horror stories of people in the US where you're having to pay hundreds and thousands of dollars for things out of pocket, whereas in the UK, the most that you would ever pay out of pocket as such would be £100 a year for a prepayment. And you know, that's if you do pay for your prescriptions, which I know people then moan about the £100 a year to get as many medication for free, and I'm like, you just don't realise how good you've got it when you go and talk to somebody from America, you know. Uh, yeah, so yeah, so fluoxetine, which is the generic for Prozac, yeah, that's been used in children. I would say for probably a couple of decades now. There's very good evidence for it for both depression and for anxiety, and for a whole load of other sort of generalized anxiety disorders and such like. Um, yeah, so 30 milligrams a day. Yeah, that is into to the adult doses, but at age 11, he's probably got very good functioning liver and kidneys. It's always an interesting one. The dosages for children can sometimes actually be more than that as adults. Things like antihistamines, the once-a-day antihistamines that adults take, children actually have to take it twice a day because they actually excrete it quicker. So they can't actually just have one for it to last the whole day. They actually have to take it twice a day because it doesn't last in their system long enough because they actually metabolize it quicker, which is interesting to know. Yeah, Cal says people in Belgium complain to me, and I'm always like, "Ooh, you naive soul! You've got no idea how lucky we are." I know people moan about sort of certain things, and you think, like, you know, yeah, some things are really bad. Now I know that there's some people that watch my channel. Some of the biological agents now they do cost like £2,000 a month. And in the UK, if somebody hits the threshold for needing biological treatments for rheumatoid arthritis, lupus, Crohn's, migraines, all the mAbs that are used to treat them, they are totally free. There is rules, we've got rules and we've got pathways over which ones to start. But I know of people that have reached out to me through YouTube and such like that are on them in America, and you're having to pay the $1,000 a month to have them, and it seems absolutely ridiculous. Especially the ones are using to treat severe allergies. They're now using the dupilumab and the omalizumab being used to treat severe allergies. But the amount of extra that people are having to pay for them is ridiculous. Okay. Hi, Al. I'm really tired. So may I go sleep? Yeah. If you need to go and sleep, go and sleep. These stay on YouTube for forever. I'm not taking any of them down, so you can always go and watch these on replay. Listen to me on double speed. Supposedly, I talk too quick as it is. So if you're willing to listen to me at double speed, Tanya says because of Sean's ADHD, he can only take the Flonase and he hates it. Yeah, it can be tricky. Yeah. Right. So Cal says my IBS medication is considered a luxury, so they are expensive for Belgian standards, but they still like 20 something every month. Okay. Yeah. So yeah, we do have in the UK, we are trying to say that certain medications should be classed as self-care, and that you need to actually be reaching a certain threshold to be actually having them on prescription and on the NHS, which does cause a lot of issues. You've got people, with their normal aches and pains and random headaches and things, paracetamol and ibuprofen and things like that should be bought over the counter. But you do get people that try and say, no, 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 I want it on prescription. I've paid my taxes. And like antihistamines just for sort of simple hay fever. We're trying to encourage people to spend to buy them over the counter rather than insisting on having them for free on the NHS, because they're not for free on the NHS. The NHS does only have a certain amount of budget um, for medications. We did do some local research, so we got told, well, actually, people that are in more deprived areas probably do need to have more of the self-care medication because they really can't afford it. They are below the poverty line. They really can't afford to actually go and buy these self-care medications. So we found a whole list of self-care medications and how much different GP practices were spending on these self-care medications, and then actually compared by deprivation to those GP practices. And we actually found out that those in the deprived areas weren't actually getting the self-care medication on prescription. Their patients weren't actually demanding them on prescription. They were okay when the doctor just said, you need to go and buy those. It was actually people in the more affluent areas that are actually more demanding and wanting more of these self-care medications on prescription. But it's a very hard line, and it's very hard for the GPs when they've only got a very limited amount of space to actually say, I actually think you can just go and buy that yourself. You shouldn't be wasting NHS resources on it. And it's, yeah, where do you draw the line? Yeah, as I was saying, Cal, yeah, for some reason, people with more money are often more demanding. Yeah, they're like, well, I've paid my taxes, so I'm going to get back my medication on the NHS. And that, half of me just like, well, you want it to actually be there for when you actually want the really expensive prescription only medication, not just for all the bits and pieces for a bit of random indigestion and a few aches and pains and a few sniffles. And I don't think it's until these people actually have, actually suffer from things that they really need. But then we get the opposite, that sometimes I would wish I could tell some patients, look, do you really know, when they're demanding a specific brand, to go, do you realise how much more expensive that brand is? You do not need it as the patented brand. You can just have it as the generic. There is no difference. And they're like, but I want the brand. Well, then if we started putting prices on things to show people how much it actually costs, you'd then get people that would just be like, I don't cost the NHS any money. I don't want to take other people's money. And then you're actually going to end up with worse. That it is just more inequality. So Cal says the biologicals were for a while on an actual lottery system for who can actually allow the privilege to pay £3,000 a month. Yeah, that's really unfair. That if you can afford £3,000 a month, that you can get a biological. At least in the UK, we might have a very long waiting list to actually get a diagnosis and actually get on the system. But once you are on the system and you've got a diagnosis, you get the biological as per the treatment pathway, no matter who you are. It's a bit of a, yeah, we've got the big problem of the fact that our waiting lists are too long because there isn't enough money in the system, and people do have to wait a long time until they get a diagnosis. But once they do have a diagnosis, these people do get the the medication in line with what they need, not in line with what they can pay. Tanya says the elderly get hit the most. The Medicare Part D, I think, is for the prescriptions, and I see them having to choose food or life-saving medication. Yeah, and it's such a shame that you've got people. Well, in the UK, it's usually the combination of a lot of elderly people have to choose between to eat and to heat. That's the usual phrase of the fact they've got to decide between whether they buy food or whether they pay the extortionate gas prices to heat their home. And we've now been told that with the change of the new government this year, we're not going to have pensioners aren't going to automatically get the winter fuel payment. Only those that are on pension credit. And there's a lot of pensioners out there that could get pension credit but haven't actually claimed for it and don't want to claim for it. And there does need to be some more work to actually help the more vulnerable pensioners out there. So I've rather gone off on a tangent. I just wanted this hormone one to sort of be about lots of different things. There is a lot out there about, I don't know whether any of you were sort of interested in HRT. There's a lot out there that is being targeted at premenopausal women. So many supplements out there being targeted to premenopausal women. And the majority of them don't do that much. There is no such thing as balancing your female hormones. During your monthly cycle, you have estrogen and progesterone. They both go up and down twice at different times. You then have the opposite ones. As I said, everything's always a feedback loop. So whereas you've got estrogen and progesterone, you then also have two other, they're released from your, they're released and act on your ovaries and the placenta and the lining of the womb. Well, then you also have the luteinizing hormone and the other one that actually is the pituitary, and they do the signal between. So they affect each other, and you've got the cycle every month. Now, sometimes that's totally out of whack and can cause major issues. PCOS is one of them. People with endometriosis. Well, endometriosis is where you've got pieces of the lining of the womb have actually gone into your abdominal cavity and can be attached to parts of your intestine. It can even go up and attach to your diaphragm. And they actually then increase the estrogen during the rest of your cycle and can get inflamed during the rest of your cycle. It was, I think it was, a few years ago, it blew my mind the fact that the womb and fallopian tubes actually open out into the abdominal cavity, and the ovary is away from the fallopian tube entrance. It releases an egg, and the egg has got to get sort of sucked into the fallopian tube. But it does mean that sperm actually come out the fallopian tube and into the abdominal cavity, and it's the lining of the womb can go into the abdominal cavity and cause problems. So a lot of people who have got that, so maybe on birth control, and this is things. So Kat says, I'm still on my birth control pills until I figure out who to see and what to do. Yeah, so a lot of people, so yeah, you can have the progesterone only pill for helping prevent pregnancy, and then the combined oral contraceptive pill has both the estrogen and the progesterone in it, and it actually gets used for a lot more things than just contraception. They can really help the people that have got so many hormonal issues happening, have so many painful periods. So they, even taking them as the 21 days and having a 7-day gap, then the 7-day gap withdrawal bleed, it's not an actual period, it's just a withdrawal bleed, can be much lighter and much more tolerable for people. And then even the new guidelines that have come out from the Royal College of Obstetrics in London, they're actually saying that for the combined contraceptive pill, you can join 3 packs together, or even take packs continuously, not even have a withdrawal bleed, and that can be beneficial for many women who just cannot cope with any bleeding, any sort of sign of the bleeding just causes so many issues to their body. Um, and then obviously as people hit perimenopause, the estrogen and the progesterone, they don't spike as much. Your body's the ovaries are getting more sluggish. Just a thing, they don't produce as much, and they can be as much as between 5 and 10 years to actually hitting menopause, where the lowering of the estrogen is causing a problem. Estrogen is so essential for so many things, like keeping the bone strong, keeping your muscles strong. In a way, you can sort of think about it acting similar to testosterone in a man. So when a man starts to lose his testosterone, he can actually sort of lose muscle mass, lose bone strength. And it's the same with losing the estrogen in a woman. You can lose muscle mass, bone strength. It can affect the cardiovascular system. And so a low dose of HRT can be so beneficial for many women. Now, there was always an issue about people being scared of taking estrogen, thinking that it may increase breast cancer, it may increase blood clots. And although historically they used to be the pills and the HRT that used to be around used to be really higher doses of estrogen. Nowadays, those doses of estrogen have been much lowered, so the amount that's needed for contraceptive pill and for HRT nowadays is a much lower dose, which is much safer. They're also more sort of bioidentical estrogens to what they used to be, which are also a lot safer. And even though they can maybe slightly increase the risk of issues, having estrogen may slightly increase the risk of breast cancer progressing, very slightly, but it actually also reduces the amount of internal ovary cancers. So ovarian cancer. So it actually reduces the risk of ovarian cancer. So when you actually look at overall, having estrogen doesn't increase your overall risk of cancer, because although it might slightly increase one, it slightly decreases the other. And with the way that it also helps strengthen the bones and stuff, such like, is great. With the estrogen potentially causing blood clots and causing strokes, DVTs and such like, yes, there is a very slight increased risk. But if you were to say somebody's baseline risk was 1, it would maybe increase it up to maybe 1.1, 1.2. So very slight increased risk. If that same person was to get pregnant, the increase of their estrogen levels during the pregnancy would actually increase that risk of clots during pregnancy 9-fold. So even by being on the contraceptive pill by 10 years, you've still lowered your risk of having a stroke or a DVT to that of being pregnant for a year. So it's sort of, weighing off one set of risks to another set of risks. And it's, as long as a woman is informed, and I'm very much for the fact that people should be being much informed about what they're doing, as long as they're informed about what there might be a slight increased risk of this, but this is the benefits that you are going to have from it. Are you willing to take that slight risk over all of these benefits that you're going to have? Yeah. So Kat says, yeah, that's what I've been doing for years and years. It has kept me steady. Cal says that libido is such a blessing, and that's sort of the testosterone. And ensuring that people have the correct levels. So correct levels of testosterone are needed for muscle growth and bone stability and such like. So it's all a matter of having those discussions with a healthcare provider. Now, there is a new thing that women do have low levels of testosterone, and sometimes people that are struggling with perimenopausal and menopausal symptoms, especially vaginal issues and libido issues, maybe a small dose of testosterone can be helpful in that situation. It's now got very confusing because we now have three different protocols for testosterone. We've got testosterone for men that have got low male that have got low levels of their testosterone naturally and they need it boosting up. You've got the testosterone protocols for trans men that require the testosterone replacement, and now we have the protocol for testosterone for women for as a HRT for dealing with menopausal symptoms. So whenever it goes, oh, how do we use testosterone? It's like, which indication are you using the testosterone for? Like with many medications, they can be used for multiple different things, and so you need to make sure that you've got the dose right for the correct indication. Yeah, so Cal says, I only need to have my shot every 10 weeks instead of every other week, thanks to Nabido. Yeah. Yeah, it can be useful to have things where it is a lengthened course. Many people sort of, for women, may decide to have the implant or the coil. There's the progesterone impregnated coil that seems to work when people can't actually remember to take the medication every day. One thing that we've been doing some work on is the fact that if you are on HRT and you still have your womb intact, you need to make sure that you have not just estrogen, you need the progesterone, because the progesterone helps prevent problems with the uterus. But what if you don't have a uterus, then you don't need progesterone. Progesterone protects part of the uterus. So we've done some work to make sure that everybody who's got an intact uterus is on the correct type of HRT, because it's very confusing, all the different types of HRT. You've got the tablets, the patches, the gel, and such like. I've been on for an hour and a quarter now, so I think we've got 6 people on at the moment. Is there any other hormones or different medications that you wanted to know about? When it comes to sort of the adrenal gland and cortisol, really the only thing there is things like Addison's disease and such like that are medical emergencies and actually require an endocrinologist. All these people saying that you need to balance your cortisol and stress hormone with a supplement, there isn't any need. Yes, there are people that are continually, maybe if they've got trauma, maybe if they've got anxiety, are continually sort of got their stress hormone going around in their body, but no amount of supplement is going to help with that. That's going to require trauma-informed care, CBT, and such like to deal with reducing the anxiety and the actual trauma to reduce the body down into a more stable, relaxed state and to get that balance back. I have to say, I do think that the worst MLM supplement company out there is the Amare with their Happy Juice. You really can't balance things like that. That's the sort of thing that you actually need social help and therapy help with. I'd say endocrinology was such a massive module at university, and the pharmacology to go along with endocrinology was very, very complicated, and it's something I'm continually learning. There's continually new things being found out. Oh, I have a kitten. Uh, puppy. Puppy. Oh, I'm back with a kitten. This is Poppy. Say puppy? I know. You've got to go for your vaccines tomorrow, haven't you? Oh, yes, the two kittens have to go for their second lots of vaccines tomorrow. And then they get to find out when they're going to get spayed, which I don't think they'll be too happy about, but they need to get spayed if they're ever going to be let outside, don't you? Oh, hello, Nobby. The big boys come to say hello as well. Nobby, come up here. No. Yes. This is Poppy. We've got two the same. Well, sort of the same. They've got different patterns on their face. Oh, hello, you're my big boy, aren't you? And just to show, this is Nobby, how much bigger you are, aren't you? You're my handsome boy. Yes, you're still my handsome boy. Yes, you are. Yes. He's fine with the kittens. He doesn't mind them pouncing around him. He's all right. But Minnow, the other one, he is a void. He's my he's like Toothless from How to Train Your Dragon. Those big green eyes. Yeah. But yeah, he doesn't mind the two kittens running around. He keeps going and pinching the kitten's food. But Minnow, the other cat, she's no longer now the kitten and the getting all the attention. So she is getting a little bit miffed that kittens are getting more attention. So we're having to make sure that we actually give her, I think, more attention. Because I'm just going to add this one to the stage. I did have another one that sort of explained all the different sort of things. Yeah, so so you've got sort of in your brain the pituitary gland, the hypothalamus, and the pineal, and they control so many different things. Antidiuretic hormone, so that affects your kidneys, the growth hormone, which obviously during childhood is required. Obviously, any children that have got any issues with growing and their growth hormone quite often need to have the growth hormone supplemented. So we do have children who are not sort of reaching the targets, and they've got issues with the pituitary gland and the growth hormone. Require injections of growth hormone. Now there is some abuse of growth hormone, but that's not really recommended to abuse it. Obviously, it's only for people who actually need it. That was one. So the luteinizing hormone was for triggers ovulation, and then there's the follicular stimulating hormone, which is helping with the maturation and production of the sort of estrogen, and is also used for sort of sperm production in men. So thyroid stimulating hormone, and then so the androcorticosteroids for sort of the androgens and the adrenal cortex. There's so much thyroid gland things, parathyroid, pancreas, your adrenal glands for your corticosteroids and your mineral corticosteroids and your sort of short-term stress release, stress response, your long-term stress response. So they either sort of they switch on your fight or flight, where you sort of your blood goes to your muscles, you increase in your sugar levels, you're ready to either run away or fight, and then you need it switching off so that you can actually then digest food and for your body to actually repair. You need to have this sort of switch over. So, and then it doesn't have all of them on there. Okay, well, I think I'll finish this stream. It's been great to have you all on. If you've got any ideas for future live streams, then let me know. I was thinking about Rob from Mad About Skin, who was one of the very first YouTubers that I actually started going to the live streams for and watching content. And I watched a whole load of dermatologists, and following that was he gave me sort of the encouragement to actually start doing my YouTube channel. Well, he's relaunching his new Mad About Skin line. He's had it all sort of repackaged, rebranded, and he's relaunching his Mad About Skin line. So I was actually thinking of my next live stream to be a skincare special again. I know I did do a skincare special last year, but I thought I'd do it again now that I've got some new followers who might be interested, and I can talk about his products. Not that I'm paid or anything. I just, because he was the influencer that encouraged me so much, I'd quite like to sort of put out there about it, but also then go on about sort of eczema, psoriasis, any other skin conditions, acne, all of that sort of thing. So if you're interested in that, let me know. If you've got any other ideas for live streams, let me know. And I really do need to get back to actually recording some actual proper YouTube videos for educational purposes rather than just these chat style ones. Although these chat style ones are really good and I love answering your questions. Once it's been the week of my usual people watching them, it doesn't actually get any new people to my channel. That's always comes from my actual videos, my sort of 10-15 minute videos on actual subjects. So I need to get back to actually putting some of those out so I can actually get some new subscribers, because I'm stuck at about sort of I think it was 543 subscribers. I'm sort of floating around the 500, and I need to get back to sort of increasing my amount of watch hours by having people watch those videos. I'm not going to be doing any shorts anymore. The shorts that I have done that I've taken as clips out of things, all I do is that I just get hate comments on those. People just going, because they take things out of context, because I've only done it because it's only 60 seconds. They take what I say out of context, whereas obviously in a 10-15 minute video, I can explain the nuance. And on these live streams, I can explain the nuance. So thank you all for joining me again. So thank you, Tanya, Cal, all the others, Kat, and everybody else that's been on, anybody that's been lurking in the background, Al, Amanda. Yeah, just having a look back, seeing who's been on my live stream. And yeah, and anybody who's on the replay crew that's managed to get this to this point. If once the stream's ended, if you can actually leave an actual comment on my stream, that's really helpful, because it does help the YouTube algorithm push it out. But as I said, these live streams, other than my usual crew of people, it doesn't really get many new subscribers out there. But any ideas for future things, just let me know. But thank you all for being here, and I'll see you again next time.